Good morning, and thank you for joining us once again. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health here in the region of Peel, Chief Darren Rizzi from the Mississauga Fire and Emergency Services, and Sam Rogers, our Director of Enforcement. I want to start off by recognizing that it's Customer Service Week. And I want to thank our hardworking staff, all of our staff at 311, My Way, Parks, Facilities, Works, Recreation, Enforcement, Bylaw, everyone, all our staff for all the incredible work they do day in and day out. You really are the face of this city and have stepped up since the onset of this pandemic to keep our city running and ensure that our residents continue to have access to the services that they rely on each and every day. I can't tell you how many emails and texts and notes I've received from residents who are so thankful for the work that our frontline staff members do each and every day. You're making us proud and continuing what many of us already know, that Mississauga is truly the envy of the GTHA, and we thank you. So Mississauga, we're heading into the Thanksgiving long weekend, and as mayor of this city, I really couldn't be more thankful to all of you, our residents, for helping us make huge gains in our battle against COVID-19. Peel Region is now averaging 27 cases per 100,000, and that's down from 33 last week. And Mississauga is averaging 30 cases per 100,000, and that's down from 40 cases per 100,000 last week. That is a 25% drop in 7 days. For more than a month, we have seen case counts steadily decline. This has kept our hospitalizations in the region of Peel relatively stable, with 19 COVID hospitalizations at Trillium Health Partners and 5 patients in the ICU, and 16 COVID hospitalization at Brampton's William Osler Hospital and 6 patients in the ICU. I know I've been saying this week after week, but it's true. The reason why we are in this positive position is because so many of you have gone out and gotten the vaccine. We are now at 81% of all our residents 12 plus with 2 doses of the vaccine, fully vaccinated, reflecting the vaccination rates across the province. We were in a much different position than we were just 1 year ago at Thanksgiving. Heading into Thanksgiving last year, we were on the precipice of the second wave, with case counts rising and our hospitals starting to fill up with COVID patients. Today, case counts are declining across the province, and the vast majority of eligible residents have protection against COVID through the vaccine. I am so grateful that this Thanksgiving, families will be able to gather together to celebrate. But I'm asking you, please, to exercise caution and to keep your Thanksgiving gatherings as safe and as small as possible. If you're hosting an event, check with each of your guests and make sure they're feeling well, and ask them if they've been vaccinated. Please, if you can, keep your gatherings small and take them outdoors if possible. On the day of your event, open windows to increase ventilation if possible, and seat guests apart if they're from different households. And if you or anyone has any COVID-19 symptoms, anyone is unwell in your household, please cancel or postpone your event until a later date. If you plan on attending a gathering and have any COVID-19 symptoms, well, it goes without saying, you or anyone else in your household should not be attending. Please get tested and self-isolate until your test results are back. While this weekend is a time to relax and see family and friends, we won't be taking a break from our efforts to reach our goal of getting 90% of our residents here in Peel vaccinated. Over the Thanksgiving long weekend, there will be a number of pop-up and school clinics running throughout Mississauga and Peel region. In Mississauga, the Vax van will be at T.L. Kennedy Secondary School on Saturday, October 9th, from 11 a.m. to 5 p.m. Residents can either book an appointment or walk in to get their vaccine. On Saturday from 11 to 6:30 p.m., Residents, again, can either book an appointment or walk in for vaccination at Father Michael Gates Secondary School. And on Thanksgiving Monday from 10 a.m. to 5:30 p.m., the Vax van will be at the Burnham Thorpe Library, and residents can simply show up to get their vaccine. So please, if you haven't done so, go out and get vaccinated. Do it to protect yourself, your loved ones, and the entire community. Do it so you can get back to doing the things that are important to you and to your mental and physical well-being. The vaccine certification program now in place, and you need a proof of vaccination to dine indoors, to go to the movie theater, or to go to the gym, and in the coming weeks, to attend a Leafs or a Raptors game. Sorry, Jays. There really has never been more incentive to get the vaccine. Here at the City of Mississauga, our employees and our volunteers have begun the process of disclosing their proof of vaccination. Part of the vaccination policy that we've put in place to keep our employees and volunteers and the residents we serve safe. Employees who fail to disclose their vaccination status or those who are unvaccinated will have to participate in education sessions on the vaccine. If the employee fails to disclose or remains unvaccinated by October 31st, they will have to undergo regular COVID testing in order to enter the workplace beginning November 1st. I'm very thankful yesterday that Prime Minister Justin Trudeau and Deputy Prime Minister Chrystia Freeland provided more details on a similar policy that will require federal employees to be vaccinated by October 30th, as well as require federally regulated air, rail, and marine transportation sectors to establish vaccination policies for their organizations. The Prime Minister also made good on a promise that he announced prior to the election, and that is, effective October 30th, all travelers departing from Canadian airports and boarding trains in Canada will be required to be fully vaccinated. I'm extremely supportive of these policies, especially because the City of Mississauga is home to Canada's largest airport. These policies are measures to control the spread of the virus, and I want to thank the Prime Minister and the Deputy Prime Minister and the federal cabinet for taking action to keep our community safe. Before I bring up Dr. Lowe, I just want to give you an update on our citywide Thanksgiving food drive. Because of the enormous generosity of our community, we are now halfway to our goal of raising $400,000 and 200,000 pounds of food for the Mississauga Food Bank by October 17th. I want to thank everyone who has already donated, but we still have more work to do. And that's why this Saturday, in collaboration with the Mississauga Food Bank, we will be hosting a contactless Thanksgiving drive-through event. And I encourage all residents to come by and drop off or donate some of the most needed food items, including peanut butter, canned fruits and vegetables, and of course, pasta. The drive-through event runs between 10 a.m. and 2 p.m. at the Mississauga Food Bank at their headquarters, which is on Universal Drive in Mississauga. So please consider dropping by if you can. This is an incredibly important cause, as the Mississauga Food Bank has seen a 167% increase in people accessing the food bank for the first time since the onset of the pandemic. I really hope to see you there. If you'd like to make a financial contribution, and if you can, please go to themississaugafoodbank.org and you can donate there. Thank you. Lastly, I'd like to wish all of Mississauga's Hindu community a joyous Navratri. Navratri is a celebration of triumph of good over evil, and one of the most important guiding principles and virtues of Hinduism. May the next 9 nights fill you with peace and happiness as you celebrate the blessings of the new year. So Shubh Navratri. And now I'd like to invite up Dr. Lowe to give his update.
Thank you, Madam Mayor, and good morning. Mississauga's new case rate this week is 30.3 per 100,000, and test positivity is at 2.6%. Peel's vaccination coverage rate stands at 81% of our eligible 12-plus population. Our fourth wave to date reflects the high vaccine coverage in our community and also our vigilance. Your actions are making a difference. I'm especially thrilled to see that thousands of residents are still coming forward to get their first dose every week. Thank you for doing the right thing to keep yourself, your family, and your community safe, and to help ensure that we continue to move forward. Peel Public Health is continuing to review Monday's school-based rapid antigen testing announcement from the province, and we remain in conversation with other health units, our school board partners, and our provincial partners to determine how and where these tests might best be implemented. Under certain circumstances, rapid antigen testing can complement other preventive interventions already in place, such as screening, masking, cohorting, and dismissals. However, we want to ensure that tests are deployed in the most optimal fashion possible and will provide updates on any local plans around rapid testing in schools as they come available. I do want to thank all parents and guardians who are doing their part to keep our schools safe and open. And I ask all parents to continue to help us by remaining vigilant. Please don't send your children to school if they are sick. Please ensure that they are tested and stay home if they have any symptoms. Also, if your child is 12 to 17 years old and eligible for a vaccine, ensure that they receive their 2 doses. Should you have any questions or concerns, you can get information at peelregion.ca/COVID-19 vaccine or visit a clinic to put your mind at ease. Your diligence will help to keep our students in school and in person. As Mayor Crombie noted, as Thanksgiving approaches, we have come a long way since last year. Almost a year ago, we were on the verge of implementing broad closures and virtual gatherings were necessary to keep us all safe and to slow the spread. At that time, we were all unvaccinated and susceptible to a novel virus. Now, while celebrations aren't back to normal yet, they are definitely different this year from last. It is still important, however, to celebrate safely. Keep groups small, prefer the outdoors if you can, and do ensure that you are masked if you are celebrating with anyone who is unvaccinated for their protection. We know that those who remain unvaccinated and have not yet received 2 doses of vaccine are at the highest risk of severe outcomes with Delta. Also, please remember that gathering limits remain at 25 indoors and 100 outdoors, and really, that smaller is safer. Your diligence will ensure that Thanksgiving weekend is one of celebration and not of reversal in the midst of this 4th wave. So let's keep working together. Please get vaccinated if you haven't already, and please ensure that you stay safe over the long weekend. I wish you all a happy Thanksgiving, and I'm happy to pass it back to Mayor Crombie at this time.
Thank you, Dr. Lowe. And now, along with Dr. Lowe, Chief Rizzi, and Sam Rogers, we are happy to take your questions.
Mayor Crombie, your first question is from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Welcome, Steve.
Morning, Mayor Crombie. How are you?
I'm very well. How about you?
Not too bad. I wanted to ask about how the employee COVID-19 proof of vaccination program is developing.
Yep.
Yesterday, Toronto issued a release outlining the number of employees that have disclosed their vac status and said starting next month, employees that don't provide their vaccination status would be suspended for 6 weeks without pay and potentially fired by the end of the year. So I'm just wondering, will the City of Mississauga be disclosing kind of similar information around vaccination rates?
So,
and aside from the education and testing requirements, will city staff face disciplinary action if they don't disclose their status or have not been fully vaccinated?
Right. It's an excellent question. So right now, Stephen, as you know, we are in the disclosure phase, and our employees have up until the end of this week, in fact, to disclose whether they're vaccinated or not. And by October 8th, they will have to meet with their managers if they haven't disclosed. And you do realize that everyone who is either unvaccinated or fails to disclose will have to undergo an education session. And we're very hopeful that the education session will lead to more of our employees willing to become vaccinated, because by October 30th, if they're not, they will have to present negative test results to come to work on November 1st. So we're still in that disclosure phase, and we're reassessing and reevaluating as we learn more and more about our own employees, our own staff's vaccination status. So we don't have the data yet that Toronto has, and we're looking at the policies of all the municipalities surrounding us, including Toronto, Brampton, Oakville, Halton, etc. And we will make those decisions in the weeks to come.
Okay, and thank you. And I'm just wondering if the city's plan is to kind of keep going with the education and testing process after November 1st. Do you think that will be enough for the perhaps small percentage of city employees that may not be choosing to get vaccinated? Will it be enough to convince them to get vaccinated?
Well, I'm very hopeful that that's the case, and we'll give them every opportunity to get vaccinated and continue education, but it will become cumbersome to be presenting negative testing every time they come to work at their expense too, right? So we're very hopeful, and I'm not going to make any pronouncements on whether we'll take the same approach as Toronto has, but we're evaluating and we're always reassessing. So we'll be looking at it as well, but I don't have the data yet. I don't know what percentage of our employees are fully vaccinated or have failed to disclose. So we will see next week. Perhaps this time next week I'll know a little bit more. And we know that I think there was 4,500 of all of Toronto's staff that have not been vaccinated or failed to disclose.
Your next question comes from Declan Finnegan from Mississauga. Go ahead, Declan.
Welcome, Declan.
Thanks, Bonnie. How are you?
I'm so well. Thank you. Thanks for joining us.
That's good. Thank you. Actually, my question this morning is for Dr. Lowe.
Yep, no
if
problem.
That's okay?
Yep, absolutely.
Thank
Bring
you.
him up. And wish Khaled a happy birthday for me, will you?
I absolutely will.
Hi, Declan. Go ahead with your question.
Thank you, Dr. Lowe. I'm just concerning the renting out by homeowners of their backyard pools for staycation sort of thing through the I guess the U.S.-based website Swimply. I know it's become a bit of a topic in Toronto. They're dealing with it. Have you been following this situation? And if so, what concerns from a public health standpoint would you have with respect to that? People renting out their backyard pools for parties and so forth.
Yeah, thanks so much for the question, Declan. I mean, there's a number of concerns associated with Swimply and other pool sharing sites. We do know that commercial pools are regulated under Ontario Regulation 565, and I know that our Health Protection Division has been looking very carefully at how the regulation may apply to individuals who do rent their homes out on Swimply. In addition to the application of commercial swimming pool regulations, we do also have COVID regulations still in place if individuals are choosing to gather at a party, and really ensuring that those gathering limits and other precautions, particularly if indoors, are adhered to. So I think there's a number of things there that are associated. I do know that this is something that has been brought to the attention of the ministry, and conversations are continuing as to how health units can align on a consistent approach to pools that are being rented out on Swimply.
Okay, just to follow up, Dr. Lowe, is it something that, from a public health standpoint, that you would like to see prohibited rather than just regulated?
Well, like I said, we're in the midst of actually trying to these conversations with the ministry and certainly other health units like the City of Toronto at this time. But we don't have a specific position, at this time as to prohibition or otherwise. That said, given that it is a commercial use of a pool, we do remind individuals that the regulations would presumably apply. And certainly, if there is COVID, if there's a large gathering, then the COVID protocols would also apply at this time as well. But we don't have a specific position one way or the other at this time at Peel Public Health. Thanks so much for the question.
Thank you.
Thank you. We're ready for our next question.
That was your last question for the day.
Thank you. Well, thank you all for joining us.